I think genetic counselling is quite a unique combination of skills, really. So you've got the genetic laboratory scientific side of things. You've also got the medical health side of things, so asking patients about their health, helping them think through options, so reproductive options, screening, risk-reducing options, depending on what their health condition is. And then there's also this other aspect of really kind of complex psychosocial counselling skills that we bring in as well to help families cope with their genetic diagnosis and cope with that feeling of having passed something on to a child, which for a lot of parents that can have a really big impact. So much of what we do is so subtle, and to try and explain to someone the subtleties and the nuances of what a genetic counsellor does, I just think is really difficult. As a single genetic counsellor, I've trained in prenatal cancer, cardiac, ophthalmic. So someone can come and sit in front of me because they've got a child with something, but actually their mum had breast cancer, their grandma had ovarian cancer, and I can just put a different health condition hat on and think about that. You know exactly what you do, and when you're in that clinic room, when you're in that moment, you can feel exactly the power and the strength of what's happening. Thinking about a complex case that I've done, I guess a situation that I was in quite recently was a lady who came to me who had a neurological condition in the family that she was at risk of carrying and developing symptoms of later on. That would be a degenerative condition, and she was in her late 30s. She was at that stage in her life where she really wanted to have a child, but absolutely wanted to avoid passing the condition on. Just seeing her go through all those hosts of emotions, dealing with firstly the chance of having this condition herself and having to face going down a pathway where she could potentially become affected, and the effect that has on a person and their life, their job, their friendships with people, the things they're not able to say in social situations. The impact on her was just so huge, and to be sharing that moment with her I think was really powerful, and then to help guide her through to thinking about reproductive options and where she could go with that, and helping her come to what she felt was a comfortable decision for her moving forward.